Hi, welcome to NCLEX over NCLEX. This video is about fundamentals of nursing practice questions. Don't forget to pause for more time. Let's get started. Question number 1. A nurse is caring for a patient who has complications related to type 2 diabetes mellitus. The nurse researches new procedures to care for foot ulcers when developing a care plan for this patient. Which QSEN competency does this action represent? A. Patient-centered care. B. Evidence-based practice. C. Quality improvement. D. Informatics. C. Quality improvement involves routinely updating nursing policies and procedures. Providing patient-centered care involves listening to the patient and demonstrating respect and compassion. Evidence-based practice is used when adhering to internal policies and standardized skills. The nurse is employing informatics by using information and technology to communicate, manage knowledge, and support decision-making. A nurse is assessing a patient who is diagnosed with anorexia. Following the assessment, the nurse recommends that the patient meet with a nutritionist. This action best exemplifies the use of A. Clinical judgment. B. Clinical reasoning. C. Critical thinking. D. Blended competencies. A. Although all the options refer to the skills used by nurses in practice, the best choice is clinical judgment as it refers to the result or outcome of critical thinking or clinical reasoning. In this case, the recommendation to meet with a nutritionist. A nurse working in a long-term care facility bases patient care on 5 caring processes: knowing, being with, doing for, enabling, and maintaining belief. This approach to patient care best describes whose theory? A. Travelby's. B. Watson's. Circa Benner's. D. Swanson's. Answered. Swanson, 1991, identifies 5 caring processes and defines caring as a nurturing way of relating to a valued other toward whom one feels a personal sense of commitment and responsibility. The nurse practices using critical thinking indicators, CTs, when caring for patients in the hospital setting. The best description of CTIs is A. Evidence-based descriptions of behaviors that demonstrate the knowledge that promotes critical thinking in clinical practice. B. Evidence-based descriptions of behaviors that demonstrate the knowledge and skills that promote critical thinking in clinical practice. C. Evidence-based descriptions of behaviors that demonstrate the knowledge, characteristics, and skills that promote critical thinking in clinical practice. D. Evidence-based descriptions of behaviors that demonstrate the knowledge, characteristics, standards, and skills that promote critical thinking in clinical practice. C. Evidence-based descriptions of behaviors that demonstrate the knowledge, characteristics, and skills that promote critical thinking in clinical practice. A client who has been admitted to the hospital for the treatment of a gastrointestinal bleed requires a transfusion of packed red blood cells. Which of the following aspects of the nurse's execution of this order demonstrates technical skill? A. Starting a new, large-gauge intravenous site on the client, and priming the infusion tubing. B. Understanding the RH system that underlies the client's blood type. C. Ensuring that informed consent has been obtained and properly filed in the client's chart. D. Explaining the process that will be involved in preparing and administering the transfusion. Answer. A. Rationale. Performing tasks that require manual dexterity is a manifestation of technical skills. Explaining the transfusion process is largely dependent on interpersonal skills, while understanding the theory behind blood types is indicative of cognitive skills. Informed consent lies within the domain of legal, ethical skills. A nurse is examining a child 2 years of age. Based on her findings, she initiates a care plan for a potential problem with normal growth and development. Which step of the nursing process identifies actual and potential problems? A. Assessing. B. Diagnosing. C. Planning. D. Implementing. Answer. B. Diagnosing. Last question. Legally speaking, how would the nurse ensure that care was not negligent? A. Verbally reporting assessments to the client's physician. B. Keeping private notes about the care given to each assigned client. C. Documenting the nursing actions in the client's record. D. Tape recording complete information for each oncoming shift. C. Documenting the nursing actions in the client's record. Thank you so much for watching. There will be more questions about fundamentals of nursing coming up soon. Let me know in the comments below what questions from your classes you prefer me to upload. Please don't forget to like, comment, and subscribe.